I'm Mackenzie. I'm a sophomore at University of Texas at Austin. I participate with Advocates for Youth in the Youth Leadership Council. I am also president of the Texas Freedom Network Student Chapter. A School Health Advisory Council is a group of concerned community members, health professionals, faith leaders, teachers, parents, students who all work together to make suggestions to the school board about health education policy. I learned about the opportunity to participate in SHACs through the Youth Leadership Council of Advocates for Youth and the local Texas Freedom Network. And as soon as we figured out what it was, we went to a meeting just to kind of see what they do. And then at the next meeting submitted my application to join, and I've been going ever since. The Texas legislature requires that every school district in Texas has a school health advisory council that is active in making suggestions to their local school board. SHAC is the go-to group of people for sex education policy in the community. They are also the go-to group for anything health-related that has to do with students in the district. Unfortunately, not every school district in Texas has a webpage for their local SHAC, so sometimes you have to call the district offices and just sort of ask around and find somebody who knows about it. And in some cases, there might not even be an active SHAC, so it's an opportunity to start one. The SHAC meets once a month, and then committees meet separately outside of the monthly SHAC meeting. Typically, at a normal SHAC meeting, we talk about a lot of issues that relate to student health, such as childhood obesity, accidental injury, heart health, and teen pregnancy prevention is something that we've been talking about quite a bit, although the connection with teen pregnancy prevention and sex education for some reason has not really been made. We've been trying to talk about sex education more than they typically do, since they tend to be focused in physical activity, since Texas has a very large childhood obesity problem. But the committee that I participate on is the Health Education Committee, so we deal specifically with sex education. So in that way I have a lot of influence over what recommendations we get to make. So far my experience in the SHAC has been great. Everyone has been very welcoming and very kind, despite that most of them are 30 years older than me. But it's been a really great experience. I've been able to learn a lot about how the SHAC works and how it's connected to the school board. And more specific policy issues to student health. However, the issue of sex education, which is my primary concern, has not been addressed as much as I would like it to be, but I'm working to get that up more in the conversation than it has been. Some skills that a person might need to join their local SHAC is confidence to say what they want, as well as very good public speaking skills, because a lot of being on a SHAC is telling others what you think and beginning this conversation so that you can make good recommendations to the local school board. And if you aren't comfortable enough to say what you're thinking about, then you're just going to be ignored. So it's very important that you feel confident enough to speak up. So as someone who's very concerned with sex education, it is my main interest in joining the SHAC. It's also important to remember that the School Health Advisory Council is all health. It's not just sex education or just STDs or just teen pregnancy. There is physical activity, there is accident prevention, there is childhood obesity and nutrition, and all of these different things that incorporate health. So it's really important to keep a well-balanced conversation when you go to your SHAC meeting. While sex education is important, you also have to remember that other people there have their issues and that the school district has other issues. So to be a good SHAC member, you really need to appreciate and participate in all conversation, not just sex education. So it's a really good idea to talk about other issues, especially when you first walk in, because a lot of adults can be very put off by a young person who comes in just speaking all about sex all the time. So remember that you're there for other reasons too. I definitely recommend joining a SHAC to everyone. It has been a great experience for me to really learn more about health policy in the school district and how it's created and implemented. But I should also warn that unless you feel confident speaking your mind, it can be very easy to just get forgotten about and overlooked. So it's important that you go in with a goal that you're well educated on and you can speak about confidently. It is extremely important for young people to get involved in SHACs because we're the product of all of the health education policy that we're writing. So it directly affects me, my peers, my little sister, all of her friends, and just it's really important to make sure that we have control of what we're learning in the schools.